2010 marked the 5-year anniversary of Hurricane Katrina and its devastating impact on New Orleans and the entire Gulf area. Ochsner Medical Center was the only hospital that remained open during the entirety of the storm and helped the New Orleans community survive its most difficult time. Their philosophy of helping others within the community also resonates directly with Ochsner patients. It's all about people taking care of people. Since then, the organization has dramatically expanded its facilities and areas of expertise. One of Ochsner's most important specialties is organ transplants. In 2009, 2 children from Saudi Arabia came to Ochsner Medical Center in New Orleans for an evaluation of their chronic liver disease and possible liver transplant.
My kid's sickness started with my oldest daughter, Alanuf. She was only 2 months old when we discovered her illness. She was in school until 4th grade. After that, she couldn't walk to school anymore because her whole body was weak. When she got so sick that she was in a wheelchair all the time, we took her to a doctor, and the doctor told us that now she needed a transplant. We decided to bring the kids to the United States, and we chose Ochsner because of the hospital's reputation and experience. When we first came, both of the kids were very sick. Alanuf was in a wheelchair, and Khalifa was very malnourished when they were admitted to the hospital. For 3 weeks, they received medication, nutrition, Pediasure, then they started getting better, started growing, started laughing, and started walking again. I am very comfortable with the staff and the care at Ochsner and appreciate it.
They arrived with their parents and youngest sister. They spoke no English and needed an interpreter to communicate. Then, the children met Rita Martinez. Ms. Rita, a teacher for over 20 years who specializes in English as a second language, arrived from Puerto Rico with her husband, who was also waiting for a liver transplant. Ms. Rita began communicating with the children through hand gestures, and as their friendship began to grow, she worked with them daily, teaching English.
We first met the children, my husband and I, by the pool area in the Brent house. Every day they would come down. We used like gestures like to come here, and they came. And that's how we began the relationship with the children. The children showed a lot of interest in learning the English language. We began by gestures, sight vocabulary words. I used to go and buy coloring books and crayons just to get them comfortable to be with me. We used to sit at the picnic table and just practice every day. Every day between 5:30 and 6 they would be downstairs. And that's how we began. It was a wonderful experience to be with them.
These 2 families from very different parts of the world each had unique circumstances that brought them to Ochsner. The relationship they developed through their experiences has created a special bond that will impact all of their lives forever.
I remember how sick they were when they got here and how they look now and how much better they are. They're part of our family. We take care of them in every way we can. We make sure they have what they need.
Exactly.
We will definitely make every effort possible to stay in touch with them and hopefully see them again and maybe watch them grow.
Khalifa recently received a successful liver transplant and is doing well. His sister, Alanuf, is still waiting for a suitable donor, but she continues to smile her way around her Ochsner home away from home. The future for Ochsner is the same as it always has been. The organization makes a promise to their thousands of patients every day to serve, heal, lead, educate, and innovate.
Now she wants both me another one, but remember how.
When patients like Khalifa and Alanuf come to Ochsner, they expect the very best care, and what they get is that and a whole lot more. Where you live, how you live, and what you do. It's your lifestyle 365. We'd like to thank Ochsner Health System for their participation in this program. For more information, please visit www.ochsner.org.